Evacuate, now! Ma'am, you have to go!
I'm not going anywhere, officer. When they can't breathe, they need a doctor, and I'm a doctor.
Former Navy corpsman ran small pharmacy when chemical plant leaked town discovered her secret. The amber pill bottle slipped from Mrs. Henderson's trembling fingers as the emergency sirens began wailing across Millbrook, Ohio, their urgent shriek cutting through the Tuesday afternoon quiet like a knife through silk. Behind the counter of Henderson Family Pharmacy, Dr. Elena Vasquez looked up from her prescription count, her trained ear immediately recognizing the pattern: 3 long blasts, 2 short repeat, the same chemical hazard warning she'd heard in Navy bases from Norfolk to Pearl Harbor. But what the 200 residents of Millbrook didn't know was that their soft-spoken pharmacist, who'd filled their prescriptions with gentle efficiency for 8 years, had once been Hospital Corpsman First Class Vasquez, NBC Nuclear Biological Chemical Warfare Specialist, whose job had been keeping Marines alive when the air itself turned poisonous. The townspeople who knew her as the woman who remembered their children's names and always had a lollipop ready were about to discover that she'd once counted lives in gas attacks instead of pills in bottles. The Hartley chemical plant's catastrophic leak was about to reveal that their quiet neighborhood pharmacist was the only person in 3 counties qualified to save them all. Millbrook, Ohio, nestled in the industrial corridor between Cleveland and Akron, represented the kind of small American town where everyone knew everyone else's business, except when they didn't. The Hartley chemical plant had anchored the local economy for 37 years, its towering smokestacks and sprawling facilities providing 800 jobs while producing the industrial solvents and pesticides that kept modern agriculture functioning. The plant's safety record had been exemplary, its emergency protocols regularly praised by state inspectors who'd never imagined a scenario where multiple system failures could create the perfect storm of chemical disaster. Dr. Elena Vasquez embodied the invisible heroism of military veterans who'd transitioned to civilian careers that utilized their specialized skills in ways their communities never recognized. At 42, she carried herself with a quiet competence that marked career military personnel, her movements economical and precise, whether she was counseling patients about drug interactions or compounding specialized medications for the area's veterinarians. Her PharmD from Ohio State had been earned using GI Bill benefits, but her real education had come during 12 years of Navy service that included deployments to chemical weapons disposal sites and hazardous material incidents that civilian emergency responders could never handle. The Henderson Family Pharmacy she'd purchased from its retiring founder was a throwback to an earlier era of American healthcare, where pharmacists knew their customers' medical histories and acted as informal healthcare consultants for communities that couldn't afford specialists. Elena's approach combined old-fashioned personal service with cutting-edge pharmaceutical knowledge, her military training in chemical analysis, allowing her to compound medications that larger chains couldn't or wouldn't prepare. Her military background was carefully compartmentalized, shared only with fellow veterans who understood the weight of specialized service and the challenge of translating warrior skills to peaceful purposes. Her Navy career had encompassed not just standard hospital corpsman duties, but advanced training in chemical agent identification, decontamination procedures, and mass casualty management that had prepared her for scenarios that most medical professionals prayed they'd never encounter. The NBC warfare specialty that had defined her military service was both highly classified and incredibly dangerous, involving exposure to chemical agents under controlled conditions while learning to protect others from weapons designed to kill through the air they breathed. Her experience included live agent training exercises, deployment to chemical weapons destruction facilities, and real-world responses to industrial accidents, where her expertise had saved lives that conventional medical training couldn't have preserved. Elena's transition to civilian pharmacy had been strategic rather than accidental, her choice of profession allowing her to maintain connections to chemical knowledge while serving a community that benefited from her expertise without knowing its true depth. Her ability to identify drug interactions, understand chemical structures, and predict physiological responses was enhanced by military training that approached chemistry as a matter of life and death, rather than academic theory. The broader context was a post-9/11 America, where chemical threats were taken seriously by military and intelligence agencies, but largely ignored by civilian communities that assumed such dangers were distant and theoretical. Elena's dual identity as neighborhood pharmacist and chemical warfare specialist made her uniquely qualified to bridge the gap between military preparedness and civilian vulnerability. The Hartley chemical plant's safety protocols were designed by engineers who understood industrial processes but had never experienced the chaos of actual chemical emergencies, where theoretical procedures collapsed under pressure and improvisation became the difference between containment and catastrophe. The facility's proximity to residential areas reflected decades-old zoning decisions that prioritized economic development over public safety considerations. The collision between Elena's hidden expertise and Millbrook's vulnerability was about to test whether one veteran's specialized knowledge could overcome institutional failures and industrial disasters that threatened to transform a peaceful community into a chemical wasteland, where survival depended on skills that only someone with Elena's background could provide. The first sign of the crisis came not through official channels, but through Elena's trained nose, which detected the sweet, cloying odor of methylisocyanate MIC drifting through her pharmacy's ventilation system. The smell was unmistakable to someone who'd spent years learning to identify chemical agents by scent alone, a skill that had kept Marines alive in environments where electronic detectors failed or were unavailable. "Mrs. Henderson, I need you to take your prescription and go home immediately," Elena announced with calm urgency, her voice carrying authority that her regular customers had never heard before. "Close all your windows, turn off your air conditioning, and stay inside until further notice." The elderly woman's confusion was understandable. Elena's sudden transformation from gentle pharmacist to commanding presence was jarring for someone who'd known her only as the soft-spoken professional who always had time for small talk about grandchildren and garden vegetables. But Elena's military training had taught her that civilian lives often depended on immediate compliance with instructions they didn't understand. The emergency broadcast that followed confirmed Elena's worst fears. "This is Millbrook Emergency Management. The Hartley chemical plant has experienced a significant release of toxic materials. All residents are advised to shelter in place immediately. Close all windows and doors, turn off heating and cooling systems, and await further instructions." Elena's assessment was immediate and professional, her NBC warfare training providing context that civilian emergency management lacked. My-C was the same chemical responsible for the Bhopal disaster in India, where thousands had died from exposure to concentrations that were initially considered manageable by plant operators who didn't understand the compound's lethal potential. Her pharmacy's location, 3 miles downwind from the Hartley plant, placed it directly in the path of the chemical plume, while also making it a potential treatment center for casualties who wouldn't survive transport to hospitals in Cleveland or Akron. Elena's decision to remain open violated emergency protocols, but reflected military training that prioritized saving lives over following procedures that hadn't been designed for actual chemical warfare scenarios. The first casualties began arriving within minutes, construction workers from a job site between the plant and town. Their symptoms, classic MIC exposure, burning eyes, difficulty breathing, and skin irritation that would progress to pulmonary edema if untreated. Elena's triage was swift and professional, her military experience allowing her to assess injury severity and treatment priorities with precision that civilian medical training couldn't provide. "I need everyone to listen carefully," Elena announced to the growing crowd of affected residents who'd instinctively sought help at the only medical facility they could reach. "You've been exposed to a chemical called methylisocyanate. It's dangerous, but it's treatable if we act quickly and follow specific procedures." Her transformation from neighborhood pharmacist to chemical casualty specialist was complete and immediate, her military bearing emerging as she organized treatment protocols using medications and equipment that happened to be available in a well-stocked pharmacy. The combination of prescription drugs, over-the-counter remedies, and improvised medical supplies would have to substitute for the specialized decontamination facilities that military chemical response teams normally used. The first challenge was immediate symptom management, using resources designed for routine pharmacy operations rather than chemical warfare casualties. Elena's knowledge of drug interactions and physiological responses allowed her to create treatment protocols that used common medications in ways that their manufacturers had never intended, turning everyday pharmacy supplies into life-saving interventions. "Sarah, I need you to call Dr. Martinez at the clinic and tell him we're implementing mass casualty procedures." Elena instructed her pharmacy technician, whose 8 years of working with Elena had never prepared her for seeing her boss take command of a chemical emergency with military precision. "Tell him we need all available corticosteroids, bronchodilators, and oxygen supplies transported here immediately." The coordination that followed would test Elena's ability to manage resources while treating casualties whose survival depended on her unique combination of pharmaceutical knowledge and chemical warfare training that no one else in the county possessed. The transformation of Henderson Family Pharmacy into a field hospital was methodical and professionally executed, with Elena's military training asserting itself as she converted retail space into treatment areas using supplies that happened to be available in a well-equipped independent pharmacy. Her pharmacy technician, Sarah Martinez, watched in amazement as her soft-spoken boss became a commanding presence who organized chemical casualty care with the precision of someone who'd done this before under much worse conditions. "Sarah, we need to establish decontamination procedures at the back entrance." Elena commanded, her voice carrying the authority of someone trained to manage mass casualty situations. Mix a 5% sodium bicarbonate solution using the baking soda from aisle 3 and the distilled water from our compounding supplies. We need enough to irrigate eyes and flush skin for at least 30 patients. The improvised treatment protocols that Elena implemented were based on military chemical warfare procedures adapted to civilian pharmacy resources. Her knowledge of drug interactions allowed her to create combination therapies, using medications that weren't designed for chemical exposure but could be repurposed to manage MIC poisoning symptoms. The corticosteroids normally used for inflammation became respiratory treatments, while antihistamines designed for allergies helped manage the systemic reactions that MIC exposure caused. The casualties were arriving faster than Elena could process them individually, forcing her to implement triage procedures that prioritized treatment based on exposure severity and likelihood of survival. Her military experience had taught her to make these calculations quickly and without emotional involvement, but treating neighbors and friends required a level of professional detachment that challenged even her extensive training. "Mr. Patterson, you're going to be fine, but I need you to follow my instructions exactly," Elena told the hardware store owner, whose exposure had been severe enough to cause significant respiratory distress. "I'm giving you a combination of medications that will help your lungs process the chemical you inhaled, but you need to stay calm and breathe slowly while they take effect." The medical interventions Elena was providing exceeded the scope of normal pharmacy practice, but fell within the emergency protocols that her military training had taught her to implement when conventional medical support wasn't available. Her ability to diagnose chemical exposure symptoms and prescribe appropriate treatments was based on experience that civilian pharmacists didn't possess, knowledge gained through scenarios that most medical professionals never encountered. The crisis escalated when the town's volunteer fire department arrived, wearing equipment that was inadequate for MIC exposure, their standard hazmat suits designed for petroleum products rather than the industrial chemicals that required specialized protective gear. Elena's intervention potentially saved their lives by preventing them from entering contaminated areas with protection that would have failed catastrophically. "Chief Morrison, those suits won't protect you from methylisocyanate," Elena announced with authority that surprised the fire chief, who'd known her only as the pharmacist who filled his blood pressure medication. "MIC penetrates standard hazmat materials. You need full-face respirators with organic vapor cartridges, and even those will only give you limited exposure time." The revelation of Elena's chemical expertise was gradual but undeniable as she demonstrated knowledge that exceeded what any civilian pharmacist should possess. Her ability to identify chemical agents by smell, understand exposure pathways, and predict symptom progression reflected training that belonged in military chemical warfare units rather than small-town pharmacy practice. Dr. James Martinez, Millbrook's only physician, arrived to find Elena managing chemical casualties with competence that exceeded his own emergency medicine training. His willingness to follow her lead reflected both professional recognition of her expertise and practical acknowledgement that she possessed knowledge essential for patient survival. "Elena, where did you learn chemical exposure treatment?" Dr. Martinez asked during a brief break between patients. "This isn't covered in civilian medical training, and you're implementing protocols that I've only read about in military medical journals," Elena's response was honest, but incomplete, her military background still partially classified despite years of civilian service, Navy hospital corpsman, specialized training in chemical and biological warfare defense. I hoped I'd never need to use it again, but today isn't about what I hoped, it's about keeping our neighbors alive. The broader implications were becoming clear as news crews arrived to document what appeared to be a chemical disaster successfully managed by a small-town pharmacist whose background suggested capabilities that exceeded her official qualifications. The story was building toward regional and potentially national attention as authorities struggled to understand how Millbrook had avoided the mass casualties that similar chemical accidents had caused in other communities. The pharmaceutical interventions that Elena was providing required precise dosing and careful monitoring, her ability to calculate drug interactions and predict physiological responses, allowing her to use common medications in ways that achieved therapeutic effects for chemical exposure symptoms. Her military training in combat medicine provided the foundation for treatment decisions that civilian medical protocols didn't address. The logistical challenges were mounting as Elena coordinated with emergency responders who were arriving from throughout the region, their equipment and procedures designed for conventional emergencies rather than chemical warfare scenarios that required specialized knowledge and equipment. Her role was evolving from pharmacist to incident commander, as authorities recognized that she possessed the expertise necessary to manage the crisis effectively. The escalation was building toward a confrontation with state and federal authorities who would demand explanations for Elena's capabilities, while media attention focused on the small-town pharmacist whose quick thinking had prevented what could have been one of the worst industrial accidents in Ohio history. The crisis reached its peak when state emergency management officials arrived to find Elena directing chemical casualty operations with military precision that exceeded their own training and equipment capabilities. The disconnect between her civilian identity and obvious expertise created suspicion among authorities who couldn't understand how a small-town pharmacist possessed knowledge typically restricted to military chemical warfare specialists. "Ma'am, I'm Director Patricia Williams with Ohio Emergency Management," announced the state official whose arrival should have represented relief, but instead created jurisdictional complications. "We need to establish proper command structure and implement state-approved chemical incident protocols. You'll need to step aside while our specialists take control of this situation." Elena's response was measured but firm, her military training having taught her that bureaucratic procedures often conflicted with medical necessity during actual emergencies. "Director Williams, I appreciate your authority, but I have 37 patients undergoing treatment for methylisocyanate exposure. Any disruption to their care could result in fatalities that proper medical continuity will prevent." The confrontation that developed reflected broader tensions between civilian emergency management and military-trained specialists whose expertise exceeded official protocols, but whose authority wasn't recognized by agencies that prioritized procedure over results. Elena's position was medically sound but jurisdictionally questionable, creating conflict that could undermine patient care while satisfying bureaucratic requirements. The darkest moment came when Elena realized that state officials were planning to evacuate patients to hospitals that weren't equipped for chemical exposure treatment Their transportation and treatment protocols designed for conventional medical emergencies rather than industrial poisoning that required specialized intervention. The proposed evacuation could kill patients who were stabilizing under Elena's care, but whose conditions were too fragile for transport. Director Williams, these patients cannot be moved for at least 6 hours. Elena explained with clinical precision that emphasized medical necessity over administrative convenience. Methylisocyanate exposure causes delayed pulmonary edema that could prove fatal during transport. They need continued monitoring and immediate intervention if their respiratory status deteriorates. But the state's legal liability concerns were overriding medical judgment, their insurance and regulatory frameworks unable to accommodate situations where unauthorized personnel provided treatment that exceeded their official qualifications. Elena's lack of formal authority to treat chemical casualties meant that state officials faced potential lawsuits if they allowed her to continue operating outside established protocols. The psychological pressure was intense and personal as Elena watched bureaucratic procedures threaten to undo the medical interventions that had prevented mass casualties. Her military training had prepared her for combat stress, but not for the frustration of watching civilians die because authorities prioritized legal protection over medical necessity. The community's response was immediate and passionate, with Millbrook residents who'd been treated by Elena refusing to accept state-mandated evacuation that could kill the people she'd saved. Their loyalty to the pharmacist who'd protected them created civil disobedience that complicated official response while demonstrating the trust that Elena had earned through her competent medical care. "We're not leaving Ms. Vasquez," declared Tom Patterson, the hardware store owner whose respiratory distress had been stabilized through Elena's treatment. "She saved our lives when the government wasn't here, and we're not abandoning her now just because some bureaucrat showed up with paperwork." The media attention was building toward national coverage as news outlets recognized that they were documenting a story about military expertise, civilian bureaucracy, and community loyalty that transcended routine emergency response. The coverage was sympathetic to Elena, but complicated her situation by attracting federal attention to her chemical warfare background. The federal investigation that was beginning would examine Elena's military service record and classified training to determine whether her civilian use of restricted knowledge violated security regulations. The paradox was devastating. Her expertise had saved lives, but using it might result in prosecution for unauthorized disclosure of classified information. The personal toll was equally severe as Elena faced the possibility that her military background would be exposed in ways that destroyed the civilian life she'd built over 8 years of quiet service to her community. The identity she carefully constructed was being dismantled by the very actions that had validated her worth as both veteran and civilian. The darkest realization was that Elena's success in preventing mass casualties had created problems that failure would have avoided. If people had died, her role would have been minimized and forgotten. Because she'd saved lives using classified knowledge, she faced investigation and potential prosecution that could destroy everything she'd built since leaving the Navy. The investigation that state and federal authorities were coordinating would determine whether Elena was a hero who'd saved her community or a security risk who'd violated classified protocols with her patients' lives hanging in the balance while bureaucrats decided whether her expertise was asset or liability to national security. The transformation began when Admiral Patricia Hayes, Surgeon General of the United States Navy, arrived in Millbrook with a team of military medical specialists whose presence immediately changed the power dynamics that had been building between Elena and civilian authorities. The Admiral's intervention wasn't coincidental. Elena's former commanding officer had been monitoring news coverage and recognized that her protege's classified expertise was being questioned by officials who didn't understand its importance. "Dr. Vasquez, I'm Admiral Hayes. I believe we served together at the Norfolk Chemical Defense Training Facility." The Admiral announced with military precision that immediately commanded respect from civilian officials who'd been challenging Elena's authority. "I'm here to provide context about your qualifications and to ensure that your medical interventions receive appropriate recognition." The validation was immediate and comprehensive, with Admiral Hayes documenting Elena's military service record and specialized training in ways that transformed her from questionable civilian pharmacist to recognized expert whose credentials exceeded those of most emergency response specialists. The Navy's official endorsement of Elena's actions provided legal protection while establishing her authority to continue treating patients. Director Williams' Dr. Vasquez is a highly decorated hospital corpsman whose NBC warfare training represents some of the most advanced chemical casualty management expertise in the world. Admiral Hayes explained to state officials whose ignorance of military specialties had led them to question Elena's competence. Her interventions today prevented what could have been one of the worst chemical disasters in American history. The education that followed was comprehensive and enlightening, with Admiral Hayes explaining military chemical warfare training to civilian officials whose understanding of such programs had been theoretical rather than practical. Elena's expertise was revealed as legitimate military specialty rather than mysterious civilian knowledge, creating context that justified her treatment decisions. The breakthrough came when Admiral Hayes authorized Elena to brief state and federal officials on methylisocyanate exposure treatment protocols, sharing knowledge that had been classified but could now be disclosed for public safety purposes. The briefing transformed Elena from suspect pharmacist to expert consultant whose advice would guide official response to the chemical accident. Methylisocyanate is among the most lethal industrial chemicals in common use. Elena explained to assembled officials, her voice carrying the authority of someone whose expertise had been validated by the highest levels of military medical leadership. The treatment protocols I implemented are based on military research conducted after the Bhopal disaster, when the Navy was tasked with developing response capabilities for similar incidents. The revelation of Elena's true background was handled carefully to protect both national security and her personal privacy, with Admiral Hayes explaining that Elena's transition to civilian pharmacy had been encouraged by military leadership, who recognized that her expertise would be valuable in civilian applications. Her choice of profession had been strategic rather than accidental, placing chemical warfare knowledge in a community setting where it could serve public health. The patients under Elena's care continued to improve under treatment protocols that Admiral Hayes confirmed were textbook military medicine adapted to civilian resources. The improvised treatments that state officials had questioned were revealed as sophisticated medical interventions that utilized Elena's unique combination of pharmaceutical knowledge and military chemical warfare training. The community response was overwhelming and sustained, with Millbrook residents organizing support that included everything from financial assistance to public recognition of Elena's heroic actions. The town that had known her as their quiet pharmacist now celebrated her as the decorated veteran whose hidden expertise had saved their lives. The media coverage that followed was carefully managed to highlight Elena's civilian contributions while respecting the classified nature of her military training. The story that emerged focused on veteran expertise, community service, and the importance of recognizing the unique capabilities that military personnel brought to civilian careers. The federal investigation was concluded with Elena receiving commendation rather than prosecution, her actions deemed consistent with both military ethics and civilian medical necessity. The investigation revealed that her use of classified knowledge had been appropriate for protecting civilian lives while operating within established emergency authority guidelines. The policy changes that resulted were significant and lasting, with the Department of Defense establishing new protocols for utilizing veteran chemical warfare expertise in civilian emergency response. Elena's case became a model for how military specialists could serve dual roles as civilian professionals and emergency consultants. The pharmaceutical industry recognition was equally important, with Elena receiving awards from professional organizations that acknowledged her innovative use of common medications for chemical exposure treatment. Her treatment protocols were studied and adapted for use in other industrial communities where chemical accidents posed similar threats. The personal resolution was complex, but ultimately satisfying, with Elena's civilian identity enhanced rather than compromised by revelation of her military background. The community that had appreciated her pharmaceutical expertise now understood that her capabilities extended far beyond routine prescription services. The educational impact was substantial, with Elena's experience influencing emergency management training programs throughout Ohio and beyond. Her case demonstrated the value of veteran expertise in civilian emergency response while highlighting the need for better integration of military and civilian emergency capabilities. The long-term implications extended throughout the chemical industry, with Elena's successful intervention influencing safety protocols and emergency response procedures at industrial facilities that had previously underestimated the potential consequences of chemical accidents. Her expertise became a consulting resource for companies seeking to improve their emergency preparedness. The Henderson Family Pharmacy was transformed from routine community business to regional center of excellence for pharmaceutical emergency response, with Elena's expanded role including consultation on chemical emergencies and training for other pharmacists who might face similar situations. The business that had been her refuge became her platform for continued service. The annual Millbrook Chemical Safety Day became a community tradition that honored Elena's heroic actions while educating residents about chemical hazards and emergency preparedness. The event attracted experts from throughout the region while demonstrating that small communities could effectively prepare for and respond to industrial emergencies. 5 years later, Elena's dual identity as pharmacist and chemical warfare specialist was fully integrated with her professional life, encompassing both routine pharmaceutical care and specialized emergency consultation that utilized her unique military background. The veteran, who had hidden her expertise for 8 years, was now celebrated for capabilities that served her community in ways she'd never imagined. The final scene was both personal triumph and professional validation. Elena stood before a joint session of Congress testifying about veteran contributions to civilian emergency preparedness, while wearing both her PharmD hood and her Navy Commendation ribbons. The pharmacist, who had counted pills by day and once counted lives in gas attacks, had proven that military expertise could serve civilian communities in the most essential ways possible. Veterans don't stop serving when they leave the military, Elena told the assembled lawmakers. We continue serving in civilian careers that utilize our training in ways that protect and benefit the communities we've chosen to call home. My 8 years as a pharmacist weren't separate from my military service. They were a continuation of the mission to preserve life and serve others. The Elena Vasquez incident became a transformational moment for veteran recognition and utilization in civilian emergency preparedness, demonstrating that military chemical warfare expertise could provide life-saving capabilities in industrial communities where chemical accidents threatened public health. Her heroic actions influenced federal policy and created new frameworks for integrating veteran specialists into civilian emergency response systems. The immediate consequences revolutionized Millbrook's approach to industrial safety and veteran appreciation with the community, establishing the Vasquez Center for Chemical Emergency Preparedness that provided training and consultation services for industrial communities throughout the Midwest. The center became a national model for community-based emergency preparedness that utilized veteran expertise while serving civilian populations. The Department of Defense implemented comprehensive reforms based on Elena's case, creating the Civilian Military Emergency Response Integration Program that identified veteran specialists and prepared them for potential civilian emergency roles. The program reached over 10,000 veterans with specialized military training while providing communities with access to expertise that could save lives during industrial accidents. The pharmaceutical industry transformation was equally significant, with Elena's treatment protocols incorporated into emergency response training for pharmacists throughout industrial regions. Her innovative use of common medications for chemical exposure treatment influenced professional standards while demonstrating that community pharmacies could serve as emergency treatment centers when properly prepared and staffed. The federal legislation that resulted included the Veterans Emergency Expertise Act, which created legal frameworks for utilizing veteran specialists in civilian emergencies while protecting both national security interests and civilian communities. The law established the first federal program specifically designed to integrate military expertise into civilian emergency response capabilities. The chemical industry adopted new safety protocols based on lessons learned from Elena's successful intervention with companies throughout the industrial Midwest, implementing enhanced emergency response procedures that included partnerships with veteran-owned businesses and consultation services that provided military-level chemical expertise for civilian applications. The educational impact transformed emergency management training throughout American universities, with Elena's case becoming required study for emergency management and public health programs. Her experience demonstrated the value of interdisciplinary expertise while highlighting the unique contributions that veterans could make to civilian emergency preparedness. The broader cultural transformation challenged assumptions about veteran transitions and the value of military expertise in civilian careers. Elena's story demonstrated that veterans often possessed capabilities that exceeded their official civilian qualifications, inspiring employers to recognize and utilize military training in ways that benefited entire communities. The research that emerged from documenting Elena's medical interventions influenced toxicology and emergency medicine throughout American healthcare. Her treatment protocols were validated through peer review, while contributing to medical knowledge about chemical exposure treatment that enhanced civilian medical preparedness nationwide. The annual Elena Vasquez Award for Veteran Community Service became the premier recognition program for veterans who utilized military expertise in civilian careers that served public benefit. The award influenced veteran employment programs while encouraging communities to recognize and support the unique capabilities that veterans brought to civilian professions. The enduring message transcended individual heroism to encompass fundamental truths about veteran value and community preparedness. Military expertise enhanced rather than competed with civilian capabilities. Veteran specialists provided irreplaceable resources for emergency preparedness, and the strongest communities were those that recognized and utilized the full range of talents that veterans contributed to civilian life.